introduce yourself.
Hi, I'm Dr. Tara Holber. I am an OB/GYN or obstetrician at the Swedish First Hill campus.
And I'm Kristen Gardner. I'm one of the nurse midwives, and I work with Dr. Holbert at the First Hill campus for Swedish.
Great. Thank you guys for joining us, and to everyone that's tuned in, sorry about our little rain delay, but we're excited to have you with us. So I think a great place to start would be, what is a midwife and what is midwifery?
Yeah. So I'll start, and if there's anything you want to tag on,
Yeah.
Dr. Holbert has been working with midwives for, I think, most
A
of
long
your
time,
career, so
yeah.
Hez can chime in on anything that I miss. So a nurse midwife is a nurse practitioner who studies women's health and most specifically kind of focuses on women of childbearing age or people of childbearing age, and really focuses a little bit more on pregnancy to work with people through their pregnancy and labor and birth experiences and then the postpartum. While that is a big part of what we do, we also can take care of people throughout the lifespan and also do well woman or well person care as well as care through menopause, and some people choose to do that.
Oh, really? And
Yeah.
what does that look like past pregnancy and through menopause? What kind of care, what does that experience look like?
Yeah, so I will be completely honest, that has not been a big bulk of my my practice over the years. I really have focused a lot more on pregnancy. But it would be just like going to see your regular general practitioner or women's health or person's health practitioner. So for annual exams, contraception, those kinds of things. And then as people are moving into menopause and going into that stage of their life can also help arrange with making sure you're having your mammograms and your regular screening exams for colon cancer and high blood pressure and all of those things.
Great.
Yeah.
Great. Thanks. And how is midwifery different from being an OB/GYN, and how do you guys work together?
Yeah, that's a good question. So you can start with that
Yeah.
since I just answered the last one, and I can chime in a little bit.
Yeah, totally. I mean, I think that's it's a very hard question to answer, and I've been thinking about it a lot. Because when patients ask me that, I say, I don't know, because I feel like we do everything the same. So in general, I think that an OB and a midwife, we both practice very safe medicine. We pretty much, manage patients very similarly in a lot of ways, like the main issues. But when you kind of come down to, midwife versus OB care, is just the kind of, I think, the personality and the type of patient. So midwives are, experts at taking care of low-risk women and like some with moderate risk factors, while obstetricians, we're able to take care of low-risk and moderate-risk patients, but we can also, help women through like high-risk situations, and we also do surgery too. So we do, obstetric-related surgery and then gynecologic surgeries as well. So I think that's kind of the main difference that I see.
Yeah. I think a lot of how I try to explain it to people is a lot of the nuts and bolts of, I'm just going to say pregnancy care, because that's kind of what the vast majority, I think, of people who choose to come and see a midwife is usually for their prenatal care and their labor and birth and postpartum experiences. And the nuts and bolts of those are very similar. We all make sure that pregnancy is progressing normally. We all make sure that that the person who's carrying the baby and the baby are healthy and that labs are normal and ultrasounds, like all of those are the same. Where the biggest difference I think people would find is kind of in the model of care, and each hospital has a slightly different model of how they institute either their midwifery practice or their obstetrical practice. But like our practice is kind of a group, and so people come and they'll see all of us throughout their prenatal care, versus people who choose to see an OB will oftentimes just pick that one OB and that person will see them through. So those are some kind of differences too. I think labor support sometimes is a little bit different as well. A lot of midwives tend to be kind of at the bedside a little bit more, suggesting position changes, and not that those things wouldn't happen if you have an obstetrician, but usually it's a little bit more of the midwife in the room.
Yeah.
I think. And then just as Dr. Holbert said, like, we don't do surgery, so if there are complications and if pregnancies or labors or the postpartum times become complicated, then we would have to call on one of our colleagues to come in. And so you would kind of ask, like, how does that work? How do we work together, and what makes us different? And a couple months ago, we had a shift together where we were working, and I was pretty much stuck to her side for, I would say, 23 out of 24 hours that we were together, because I needed to consult. I needed Dr. Holbert with me because some of my patients became very high risk very quickly, and one of them did end up having a cesarean birth, and then the other one, thankfully, everything settled down, and she did go on to have a wonderful vaginal birth. But so it just kind of depends. Like some shifts, we just say hi in the hall and hope you're having a great shift and call me if you need me. And then some shifts, it's a lot more hands-on.
Okay. And Dr. Holbert, you mentioned that someone that's low risk might be a candidate for using a midwife. What does that mean, and what a high-risk pregnancy look like as well?
So, you know, a healthy woman who really doesn't have any medical problems who becomes pregnant, they all start out as low risk. Someone who might have a little bit of a high blood pressure or, you know, develop some diabetes in pregnancy but able to control it with diet, they might have some risk factors, but we still consider them low risk and they're still a candidate for midwifery care. There are issues that can come up in pregnancy, or if some women have some underlying medical problems, then they might be better suited for OB care just to kind of look over, you know, some other medical issues. And then, you know, there are some just OB pregnancy-related complications that can come up, and this rarely happens where a patient actually has to be transferred from midwifery care to OB care during that kind of prenatal period. But there are issues that can come up, you know, with the pregnancy growth issues with the baby, you know, preeclampsia that becomes very severe, stuff like that. Those are cases where patients are transferred into OB care.
Okay.
Diabetes, where someone might need insulin, or
Yeah, exactly.
Okay. And another question, will I see a doctor during my pregnancy? So if someone chose to go with a midwife, when would they see their doctor?
Yeah, that's a good question. In general, patients who choose to come see us, unless there's a complication, they usually won't see a physician. Sometimes we'll do consultations without the patients actually seeing a physician. So let's say there's something that comes on an ultrasound report or something that comes on a lab result. We might say, hey, this is what we're thinking about doing with this particular finding on an ultrasound. Is there anything else that we should do? Sometimes we do need to transfer to our OBs, but I would say the vast majority of our patients don't see a physician. And these guys are thankfully there, kind of waiting in the wings, but usually they won't come in during labor unless we request them to come in, or in the postpartum period, unless we request them to.
Great.
Yeah.
Interesting. So how is your training as a midwife different than a nurse or a physician?
Yeah, that's a really good question. So there are several different types of midwives, and so I like to kind of explain that. Here at Swedish, all of the midwives here are certified nurse midwives, so we are trained as nurses. All of us have been through nursing school, and then we have a master's and or a doctorate in nursing and specialize in midwifery. So our program is different in that we don't go to medical school and then we don't do a residency in in obstetrics after that. But our training is highly specialized in midwifery and women's health.
Okay,
Yeah.
great. So we did get a question submitted from someone that's tuned in. Can I decide mid or late pregnancy to use a midwife, or do I need to decide early on?
It's a good question. People can decide at any time. We have people who transfer to us at 40 plus weeks.
Great.
Yeah, and we've had patients who, like we said, we need to transfer out late in pregnancy. So
Exactly. Yeah, like for example, I have a patient right now who I've been seeing early part of pregnancy, and as she's gone through her pregnancy and talked to more and more friends, she's started to have a lot more questions, and you know, she's had some friends that have had great midwifery care, so she kind of asked me about it, and I just said, why don't you go, and I think she's going to go to meet the midwives and meet everyone and kind of just see if that's a better fit for her. And we don't take it personally. We just want everyone to have, you know, the care that they desire, and as long as I feel like, you know, I said, yeah, you're low risk, you're a great candidate, why don't you go and check it out, and if she decides to come back to me, then I'll welcome her back. Either way, we're totally happy to, you know, exchange patients and to support each other in that way.
Right. And there are some times where, particularly in our practice, where we like to have a discussion with people and kind of get a little bit more information about their not only their pregnancy history with what's been happening with their pregnancy, but also their medical history, because every once in a while we do catch someone who comes in really hoping to transfer care, who really is in the best hands with our obstetrical colleagues, with our physicians. So, so usually what we do is we'll do a quick phone screen with them and kind of go over some of the details of their medical history and pregnancy history, and then if it sounds like everything is A-okay, then we get records and do a transfer of care.
Sounds good.
Yeah.
So we have another question. What percentage of women have successful natural births?
Can I ask a follow-up question to the question?
Sure.
I'm just wondering, is this person hoping to find out unmedicated? Like when they say natural birth, is it just a vaginal birth or an unmedicated vaginal birth?
Yeah.
Okay.
Am I digging
Yeah,
too deep
no,
into that?
No, totally, because those are very different numbers, I think.
Yeah. I mean,
Yeah.
Okay, let's give them a minute to respond.
But as far as I can answer, in our practice, our vaginal birth rate, so for our families who come into us and have are pregnant and hoping to have a vaginal delivery, it is, I think, 82-point-something%.
Okay.
That's the last statistics I looked at.
So we have an answer, unmedicated. So how many people have successful unmedicated?
Yeah, so I would say for our patients who come in wanting an unmedicated birth, and that is one of the things about choosing to see a midwife in the hospital setting, is that we don't always have people who that's a goal for them. Some people know that they want an epidural, and that is a choice of having with a midwife in a hospital setting, is to have an epidural. So for our patients who come in and that is their goal and that is their plan and they really want to have an unmedicated birth, I wish I could answer exactly, because we don't keep like that detailed of data, but I would say, and if I could just kind of reach anecdotally, it would probably be well over 50% of our patients who really come in and have a goal of an unmedicated birth. So and probably closer to 70 or 80%.
Great.
But that's what they really, really want.
Okay, and while we're on that topic, would people who want an alternative method of birth, like a water birth or something like that, would they best work with a midwife, or would they tell their OB that they prefer that method? How would that work?
Yeah. Can I answer this question?
Yeah, no. Do you want to? Well,
I mean, I can start it. So, I mean, I would
Yeah.
just say, so we do not offer water birth at Swedish. People can labor in the tub as long as they would like to. So labor can be a really comforting place for a lot of people to be. But we do not offer water birth here at Swedish. So
yeah. I echo the exact same thing. We just don't have the setup. They don't have a protocol. I was working in a hospital before this that was setting it up, but there have to be special tubs and special protocols, and we're just not set up to do that.
Yeah.
So
Okay. And with the question about natural birth, I mean, are there any pros or cons of doing unmedicated births?
yeah. Do you want to start with that?
yeah, I mean, I would say that it's a personal preference. Like, at my last job, I did centering pregnancy, and we had this, like, great exercise that basically was a spectrum of women. Like, some women said, birth is a natural process, like, we should support that natural process, and they feel like unless there's a reason for an epidural or medication, I don't want that. And then there was the other end of the spectrum of women that were just like, I have all this, advanced technology, why wouldn't I just get an epidural and not feel this whole process? Like, why would I be in that much discomfort? So everyone kind of falls on that spectrum, and there really isn't a advantage of either. There's one study showing that if you get an epidural, the second stage of labor is increased up to an hour, the pushing phase, but it's really about 20 to 30 minutes is what even a newer study showed. So really that's the only downside of having an epidural. And the benefits of having a natural delivery is if that's truly what you want, then a lot of patients feel, satisfaction in that. But there was one really good study looking at patients' like satisfaction retrospectively in their labor, whether they had an epidural or they didn't, and everyone felt the same happiness with how their labor went, as long as they had a healthy baby in their hands. Right. So
it's a really, it's such a personal choice for people, and I will always tell our families, it's not my job to try and tell you what kind of experience you want. We're going to do our best to make sure that all of those things that are really important to you happen. A lot of it is completely out of our control, which is always hard as well. I mean, it's I say this a lot, but the joy and the frustration of being in this field is that none of us really know what's going to happen until it happens. And there's a lot of things that can come up either during pregnancy or during labor and birth that we weren't maybe anticipate that can change someone's decision about whether or not they might want to choose to have an epidural or another form of pain control. And so I encourage people to read something about all of the options, just so they have some data there. It doesn't mean that we are going to try and push anything, because at the end of the day, it's not my birth, it's not my labor, and we just want people to walk away feeling that they were respected and that their wishes were granted as best that we could control.
Okay, great. Yeah. So another question we got, is a doula the same as a midwife? What's the difference?
Yeah, this is a good question. I get this a lot. And a doula and a midwife have many roles, and an obstetrician have many roles that overlap. And I would say my description is a doula's role is to provide emotional and physical support to the laboring person, and their role is to really be with that person their entire labor. A midwife, while we also provide that as well, our job is also to make sure that medically the laboring person and the baby are also doing well. So we also manage the medical side of it, and while it's not that we don't offer emotional support and physical support and those things, that's not our primary role, whereas it is for the doula. And so we all offer that. Our OB colleagues offer that as well, right? But our bigger role is to make sure that medically and from the standpoint of how labor is progressing, and that the mom and the baby, or the birthing parent and the baby, are okay, and that labor is progressing as it should.
So you had mentioned before about centering pregnancy. What is that?
That is a way to get prenatal care, and it's in a group setting. Right now, Swedish First Till doesn't offer that, but I believe Swedish Ballard does. So basically, you're matched with women of a similar gestational age, and you have group visits every month that last 2 hours, where we have it's a really actually great standardized program. So there's educational topics that we discuss at each visit, and you're just able to kind of share your experiences with other women going through the exact same thing as you. They have the exact same questions, the exact same kind of issues that come up. And women just really, really love it, and it's shown to decrease preterm birth, and I think some other stuff too. And so it's been
like
a great
an instant support group.
Exactly.
So you have all these people with you who are going to be having their babies usually within a couple of weeks of each other, and sometimes there are people who've been pregnant before and people who haven't been pregnant before, and so as the questions come up, it's a wonderful support group. We're hoping to roll it out in 2019. That's our goal.
Great.
But as we're still a little new here to First Till, we're taking our time.
That's great.
Yeah, it's a great question though.
Someone finds out that they're pregnant. How do they get connected with a midwife?
So just depending on where, of course, people are hoping for. So someone seeking a hospital-based midwifery service would, of course, be welcome to call our practice. May I give contact information? Yeah, or just...
We have the number posted right now.
Okay, great.
So anyone's welcome to call.
Yeah, they can just call. Absolutely. And if they have more specific questions, or if there are questions that come and say, I want to make sure that this medical issue that I may have wouldn't risk me out of seeing midwives, and we are always happy to answer questions over the phone as well.
Great.
Before someone makes an appointment. Yeah.
Great. So I'd like to invite anyone that's tuned in to get in your last minute questions, because we are wrapping up here. Is there anything else that either of you wanted to add to kind of discuss with the audience today about midwifery, prenatal care? Anything you'd like to let everyone know?
I would just encourage people to really, when you become pregnant, or if you're looking for healthcare in general, you want to just try and find someone who you feel like is on the same page as you. And that I have many, many, many families who come in and midwifery isn't the right model for them, and so we have wonderful OBs that we can send them to. And we have people who come in who really, it's being in the hospital setting is not the place where they want to be, and that's okay too. And so I would just really encourage people to come with questions and try and find the provider where they feel that their needs are being met, and that can look like many different things.
Yes.
So.
And I would kind of just echo that is the spectrum of care that you can get when you're pregnant varies from obviously practice to practice, but also just provider to provider. So, you know, a lot of obstetricians, they get patients who come in and their appointments last 2 or 3 minutes because patients just don't really have questions. They just want to make sure everything's okay. Where a lot of OBs will spend a lot of time with education and do that. And then there's, you know, the midwives that might spend even more time. So it's just a personal preference, and it can vary among providers in the same practice as well. So yeah, just really finding that good fit where you feel comfortable that you're getting the best care that you need as a, you know, an individual is the most important.
Okay, great. And we do have a question that has come in. Are midwives covered by insurance?
Yeah, that's another good question. We get that a lot. So all insurance companies, of course, are contracted with different providers, and we are contracted with most of the major insurance companies in the area, and are contracted with the same insurance companies that our obstetrical colleagues are. So yeah, just as long as with that particular insurance, then they should just check and make sure that we are covered with them. But yes, we do bill out insurance and are contracted with insurance companies.
So if they call the scheduler, would they be able to help with that, answer any insurance questions?
Yeah, I mean, usually our schedulers will get the insurance information, but I usually encourage people to call their insurance company directly.
Okay.
Because that is going to be probably the most accurate data that they're going to get, or information that they're going to get.
Okay, great. So we did get another question via private message. If I had a cesarean the first time I gave birth, does that mean I cannot use a midwife with my second child?
Yeah, that is a great question. We at Swedish First Hill do offer what is commonly referred to as trial of labor after cesarean, or offer labor support for people who are hoping to have a vaginal birth after cesarean. So yes.
Okay. Great.
Depending on, I mean, there are sometimes some specifics that come in that, and so usually we get more information when people come in, but the vast majority of people who are hoping to have a vaginal birth after a cesarean, we can see them.
Great. Well, thank you both so much for joining us today, and thank you to everyone that tuned in today. And if you're watching this as a recording and you have some questions, feel free to submit your questions and we'll try to get back to you as soon as we can. And we look forward to another Facebook Live. Thank you.
Thank you.
Thank you.